Did you know that a stroke is the third leading cause of death in the United States behind heart disease and cancer? 795,000 people suffer a stroke each year. Strokes can and do occur at any age. My name is Gabriel Chavez, and I'm going to talk to you about strokes, how to recognize it, what actions to take, and common risk factors. Stroke is a disease that affects the arteries leading to the brain. It occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or burst. When this happens, part of the brain cannot get the blood and oxygen it needs, so it starts to die. According to the thorough research done by the medical staff and physicians at the Mayo Clinic, stroke is a medical and life-threatening emergency, and prompt treatment is crucial. I'm going to discuss signs and symptoms, how to react, and what factors put you at risk for having a stroke. I hope this speech teaches you how to recognize the early warning signs of a stroke, because stroke victims have a better chance of recovery if someone around them recognizes symptoms and acts quickly. The longer the stroke goes untreated, the greater the damage and potential disability. Treatment given to stroke victims within the first 3 hours of the time the first symptom appears can reduce long-term disability. Let's discuss these early signs and symptoms. According to the American Stroke Association, there are 5 distinct warning signs. Sudden numbness or weakness of the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding. Trouble seeing in one or both eyes. Trouble walking, dizziness, loss of balance or coordination. Intense headache with no known cause. It is also important to know that for some people, a stroke gives no warning. One possible sign of an impending stroke is a transient ischemic attack, or TIA. It is also known as a warning stroke or a mini stroke that produces stroke-like symptoms but has no lasting damage. The signs and symptoms of TIA are the same as a stroke but last for a shorter period. Know that we have seen the early signs and symptoms. Let's talk about what to do in the event of a stroke. If you or someone you know is experiencing any of the symptoms we previously discussed, immediately call 911. Watch the person carefully while waiting for the ambulance. If the person stops breathing, beginning mouth-to-mouth resuscitation, if vomiting occurs, turn the person to the side to prevent choking, and do not let the person eat or drink anything. Finally, let's talk about factors that increase the risk of a stroke. The best treatment for stroke is prevention. According to the Texas Heart Institute, these factors can increase your risk. A family history of stroke, heart attack, or TIA, high blood pressure, high cholesterol, cigarette smoking, diabetes, obesity and physical inactivity, cardiovascular disease, and heavy binge drinking and the use of illegal drug use. Some stroke risk factors are hereditary, others result from a person's lifestyle. You can't change factors related to heredity or natural process, but those resulting in lifestyle can be modified. In conclusion, stroke is a medical emergency. Every minute counts when someone is having a stroke. Prompt threatening is crucial. The good news is that strokes can be treated, and there are fewer deaths from stroke today than were in 20 years ago. I have educated you on signs and symptoms of stroke, actions to take, and risk factors. I hope this speech has taught you about stroke, because by knowing the warning signs and risk factors, you can help yourself or a loved one or reduce the risk of having a stroke and suffering severe disability of death.